Hi, my name is Aaliyah Parker, and today I'm going to present the individual and family self management theory while incorporating it into education on guideline directed medical therapy for heart failure patients. My topic of interest is using self management techniques for individual and families to optimize adherence to guideline directed medical therapy. GDMT for heart failure with reduced ejection fraction is estimated to reduce mortality by greater than 70%, in addition to improving quality of life, according to the Journal of American Heart Association. Heart failure ranks as the leading cause of hospitalization among individuals aged 65 and older in the U.S. It also exhibits the highest 30-day rehospitalization rate compared to other medical and surgical conditions, contributing up to 26.9% of total readmissions. Research and studies have shown that patient education in heart failure treatment leads to substantial reduction in readmissions and mortality rates in heart failure patients. This has urged my project to find a comprehensive framework that would incorporate self-management for individuals and families. The individual and family self-management theory is constructed from a wide basis of self-management theories while addressing recognized gaps within those theories. Individual and family self-management involves integrating health-related behaviors into the daily routines of individuals and/or families. This approach aims to comprehend the intricate circumstances and factors that define each patient's life situation, including the roles that family members play in their health. The individual and family self-management theory highlights the focus on self-management and its impact on health outcomes, making it an ideal framework to guide my project and research. This theory not only acknowledges the crucial role of self-management skills in personalized healthcare, but also recognizes that significant influence of families in sustaining these positive behaviors. Within this theory, 3 dimensions shape the phenomena. These are context, process, and outcomes. Context encompasses condition-specific factors such as diagnosis complexity, treatment course, and physiological conditions and stability. It also encompasses environmental elements including physical and social factors like transportation, neighborhood characteristics, work environment, social networks, and community support. The process dimension pertains to self-regulation skills, emotional management, decision-making abilities, adaptation to healthy behaviors, and self-evaluation. Process acknowledges that community support and social facilitation strongly influence the likelihood of adapting to healthy behaviors. Outcome dimension focuses on the effects of engaging in behavior management of the condition, categorizing outcomes in health status, quality of life, and healthcare costs. This theory focuses on how different factors affect self-management and the steps involved, and suggests how these factors and steps are connected to enhance understanding of self-management behaviors and develop innovative interventions in patient care. Fawcett's criteria for theory evaluation provides an objective and non-judgmental framework for describing and assessing theories. These criteria include evaluating the theory's significance, internal consistency, parsimony, testability, empirical adequacy, and pragmatic adequacy. Within the individual and family self-management theory, we find elements that adequately meet all of Fawcett's criteria, with the understanding that it is crucial to recognize that theories are not absolute truths, but must be continuously evaluated and adaptable as needed while new empirical evidence is unveiled. Additionally, in the testability criteria, it must be acknowledged that not all concepts from this theory are testable, but overall testability is proven by concepts that are clearly defined and empirically measured. A hypothesis can be made linking the individual and family self management theory with education on guideline directed medical therapy to reduce hospital readmissions. By utilizing the theory's dimensions of context, process, and outcome, we can understand how individuals and families can collaboratively develop and maintain daily self management behaviors. Implementing this framework into education of heart failure medication for heart failure patients would aim to create better adherence to medication regimen by working within the process concept and addressing self-knowledge. This approach empowers patients to achieve improved self-management skills, potentially leading to decreased hospital readmissions along with overall positive patient outcomes. According to a study by the NIH, targeted interventions such as patient education before discharge are simple but effective tools that can help in reducing readmission rates for heart failure hospitalizations. The importance of reduction in this is further distinguished by a study from the American Heart Institute that points out the definite risk of being readmitted for heart failure within 30 days after hospitalization was 17.2%, while the risk of mortality within the same period was 12.6%. By lowering readmissions, patients have a chance to live longer, fuller lives. The individual and family self-management theory seeks to incorporate daily behaviors that will improve individuals' abilities to live with chronic conditions through self-management. Within the theory's body of work, it recognizes that in adults, 7% of persons between the ages of 45 to 54 and 37% of persons 75 years of age are managing 3 chronic conditions. These individuals and families are in need of unique self-management interventions that can help maintain the demands of multiple chronic conditions. There is also a financial benefit to consider. Lowering hospital readmissions through solutions like patient education and other educational measures is a shared goal that benefits both patients and healthcare organizations financially. Researchers have estimated that poor care condition contributes to $25 to $45 billion annually in unnecessary spending due to avoidable complications such as hospital readmissions. Additionally, 1 in 6 patients discharged from the U.S. hospitals is readmitted within 30 days. Implementing thoughtful, cost-effective solutions to reduce readmissions not only saves hospitals money, but also spares patients from the time and resources associated with extended hospital stays. All of these aspects are crucial in healthcare, particularly self-efficacy, which should not be underestimated. Nurses play a pivotal role in empowering their patients not only to follow prescribed care, but also to recognize their own autonomy and how to apply it effectively. By integrating the individual and family self-management theory with education on guideline-directed medical therapy, patients can adopt self-management behaviors. This approach not only benefits healthcare organizations, but also enhances outcomes for patients and their families. Thank you so much for listening to my presentation, and these are my references.